are this is a 5-year trend of chlamydia cases. You can see again, it looks like cases may be lower than previous years for 2024, but we still have a month and a half worth of cases to report. I'm guessing these will probably total cases will be on par with what we saw in 2022. Chlamydia is overrepresented in people who identify as Black or African American and females, and the vast majority, 80% of chlamydia is diagnosed in people under the age of 30. So young people are really overrepresented as well. Gonorrhea is a little bit different, so still overrepresented in people who are Black or African American. Tends to be a little bit more wide of an age distribution. So rather than 80% of cases being diagnosed in people under the age of 30, about 65% are. And males are overrepresented compared to females. And this has to do with the bacteria tends to express different genes in males compared to females, and the genes that are expressed in males tend to cause more symptoms. And so males tend to be more symptomatic from gonorrhea infection, seek care, and then get diagnosed. And so while the incidence or the number of cases of gonorrhea are higher in males, the true prevalence, the number of symptomatic and asymptomatic cases probably doesn't differ between males and females. See here, primary syphilis cases are downtrending, and they are downtrending nationwide as well. So I think that this downtrend is truly reflected in the data. Again, primary syphilis cases. So that would be the first stage of syphilis where someone has symptoms, typically a painless sore or a sore that's not very painful at the site of exposure, is overrepresented in Black or African Americans and in males. Same thing with secondary syphilis. So this would be the stage of syphilis where someone has symptoms, the infection has progressed from primary syphilis to secondary syphilis, which typically would manifest as a rash. Again, overrepresented in people who identify as Black or African American, in males as well. Like primary syphilis, cases are downtrending nationwide, and so I do think that this downtrend, this down inflection is truly represented by the data. And then late syphilis, so it's grouped together by the Department of Public Health and the CDC in the unknown or latent syphilis. So that someone doesn't have symptoms. And latent syphilis can be broken down into early latent. So someone was exposed within the prior year, or late latent, they were exposed a year or greater. Or unknown, just someone comes in and you're not quite sure if they have early latent or late latent, and so you're going to treat them like they have late latent syphilis. Cases of unknown or latent syphilis are increasing nationwide, and probably are increasing in Durham County as well. The reason for that, why primary and secondary syphilis incidence is decreasing, but latent syphilis is increasing, I'm not really sure why that's happening. But again, like other stages of syphilis, latent syphilis is overrepresented in Black or African Americans and in males. Congenital syphilis has made a lot of news over the past couple of years for good reason. Cases have increased by around 1,000% nationwide from 2012 to 2022. Over the past 5 or 6 years, we really haven't seen an increase in reported cases in Durham County. It's typically between 1 and 3 a year. So, 1 to 3 cases of congenital syphilis are 1 to 3 too many cases, but we have not seen the increase that has been seen nationwide. And congenital syphilis is syphilis in newborns, passed on from mom in utero. HIV, new cases are increasing slightly, both nationwide and in Durham County. So the estimate is we've got just under 2,700 people living in Durham County with HIV infection. And we had about just over 100 new cases of HIV diagnosed in 2023. Data for HIV is typically there's a lag, and so we don't have any data yet for 2024. I'll report on that next year. Really exciting here at the health department. We now have two people. They're trained as disease intervention specialists, but they've taken additional training to be HIV bridge counselors. So they're really entirely focused on finding people living in Durham County with HIV who are out of care. So have either missed appointments or have not been not ever engaged in care or have been out of care for a long time. And so I don't really have data to report yet because they just started doing this work a few months ago. But next year, I'm really excited, going to report some of the progress that they've made. So there's, when you look at people that are not engaged in care, the numbers that we're given from the state, reflect people who are truly not engaged in care, but also people who have moved to another county in North Carolina, moved out of state, maybe deceased, and so a lot of this work requires cleaning up data and figuring out who really is out of care, and then trying to reach those people. So I think we're going to have much more accurate numbers next year. So chronic hepatitis B and C cases, chronic hepatitis B is, really pretty steady. Most people diagnosed with chronic hepatitis B in Durham County are born in Asia. It's endemic there at very high levels. Hepatitis C is, I think, truly decreasing. It's decreased a little bit nationwide. New cases in 2023. The CDC hasn't reported data for 2024, but I think cases of chronic hepatitis C may be decreasing. So this trend is accurately reflecting the data. Vaccine preventable diseases. So you can see here, there's been an increase in some of these, varicella, chickenpox, and pertussis in particular. And I think, this increase is, reflective of kind of the COVID pandemic and children who were under vaccinated during COVID getting back into school. And so, there is some work here that needs to be done. In particular, pertussis, there's been a lot of pertussis cases nationwide this calendar year in 2024. We've had about 200 cases across North Carolina in this year, which is a big increase. And we've had a few cases of pertussis or whooping cough in Durham County. Although pertussis is a vaccine preventable disease, the effectiveness of the vaccine does tend to wear off over time. And so a lot of these people who do get pertussis or whooping cough actually have been vaccinated. And so it really speaks to the importance of getting everyone vaccinated, if possible, and getting that kind of the number up to try to get over that herd immunity level. So vector-borne diseases, really pretty steady. So the dengue and malaria cases, those would be cases where someone, got infected outside the United States and then came back as a traveler and then was diagnosed. Dengue, we've seen a lot of dengue cases globally this year, and it's actually dengue globally has increased twofold compared to last year. It's the worst global cases of dengue on record, and I think a lot of this has to do with climate change and some of the factors that are that's influencing, and I think that will only get worse over time. The bacteria that causes Lyme disease is endemic in North Carolina, particularly in Western North Carolina in the mountains, and then Rocky Mountain spotted fever. Both the vector and the bacteria really are endemic all over North Carolina, and we may see some increase in some of these endemic vector-borne diseases as well with climate change over time. Looking at bloodborne pathogens, so you can see there, has been a small increase in Group A strep cases over the past couple of years. That mirrors what's happened across the United States, and not really quite sure why this is. Some theories are it has to do with increased travel, people being around each other more after kind of the worst of the COVID pandemic. There also may be a new circulating strain of Group A strep, which tends to be more virulent than the previous strains. But this increase is likely, accurate in reflecting in the data. So waterborne diseases, so you can see here, Campylobacter tends to be the bacteria that causes the most waterborne diseases over the year. Cases tend to peak in the summer when people are outside around each other having picnics. There was an outbreak of cyclosporiasis in North Carolina over the summer that was concentrated in Wake County, although there were cases in 28 counties across North Carolina, including a few in Durham County. And the culprit was thought to be imported, I think shrimp salad. I'm not sure from where, but it was actually not a waterborne outbreak. It was a foodborne outbreak. And then speaking of foodborne outbreaks, no real changes here. Salmonellosis tends to, typically be the bacteria that causes the most foodborne outbreaks, and again, tends to happen in the summer months when people are outside getting together, eating, going on picnics and eating together. As far as tuberculosis, things, cases are pretty much like they've been the past 5 years, maybe a tick up this year. We typically have between 10 to 15 active tuberculosis cases a year here in Durham County. We are seeing flu A, at least in the wastewater. You can see this. I don't know how well you can see this, but these are reports we get weekly from the state, and they're actually pretty cool. So they're doing flu A, influenza A, influenza B, and RSV testing in wastewater at these sites. And so you can see here, a star indicates that there were trace amounts of flu A, for instance, detected in the wastewater. And the more red the box, the more of the pathogen that's being detected. So you can see, we have been, pretty consistently detecting flu A in wastewater, at least in the South Durham site. I couldn't squeeze in this same graphic for RSV, but RSV is pretty widely spread across North Carolina too, including in Durham County. No influenza B yet in Durham County has been detected. COVID, you can see again from wastewater, levels are still pretty low, after peaking over the summer months, but these levels as well as cases will probably start to increase as we, progress towards the holidays at the end of the month and people are getting together indoors. Mpox, just a word about it. We had 2 confirmed cases this year and 1 probable case in Durham County. That compares to no cases in 2023. And then, of course, in 2022, during the Mpox pandemic, we had 46 cases in Durham County. And we are still administering the Jynneos vaccine, which protects against Mpox here at the county. So I want to thank Savannah Carrico, our epidemiologist, for putting these slides together. And here you can see this is our communicable disease team, really mighty. And there's a lot of work that needs to be done every year to help keep Durhamites safe. And we have a fantastic team, and couldn't do this work without each and every one of them. That's the presentation. I'm happy to answer any questions that anyone has.
I have a question, Dr. Jenks,
Sure.
regarding the STI data that you shared. The data that's collected by the NCEDSS, Does that by chance include demographic information, particularly addresses? And if so, have you noted like certain hotspots in Durham County for those STIs?
Chair McDougall, it's interesting you asked that question. Yeah, the data that gets reported to us. So it gets reported to the local health departments, and then that gets fed into the state database. It does include demographic data. It does include addresses. And that is actually something, we've talked internally about, looking at, is trying to figure out, are there hotspots, so to speak, across Durham County where people that are getting diagnosed with these STIs tend to live, and that would help target some of our outreach efforts. Either with the health education team going out and doing more testing in those areas, or even with this mobile medical van that we're getting in 2025, doing outreach events on that. So that is something that we've talked internally about looking at, and I think we will hopefully next year. But that's a great question, and it's a really great idea.
I was going to do a follow-up question. It might be premature, and this is to you and to Dr. Jenkins. If you do find that there are hot spots, are there opportunities for churches and civic organizations perhaps to partner with the health department in educational efforts to try to help to reduce the prevalence of those infections in the county?
I mean, I can certainly let Dr. Jenkins speak to this, but I will say, I mean, that's what we did during COVID, during our COVID vaccine outreach, and it was really effective. And that, I think, was one of the lessons that we learned during COVID, is that, buy-in from community leaders and trusted leaders is really important. And so I think that, that would be, a great idea to kind of involve them as we, move forward.
Couldn't agree more. We have the playbook, Dr. McDougall and members of the board. It's just a matter of just continuing to go back to that playbook. We do have a great representative in Willa Allen Robinson, who is very in tune with the faith community as far as our faithful families and health ministry. So we do have a very strong network of ministers who really know about our services, and when we approach them, it wouldn't be a novel act. They know that we're coming for a specific purpose. So Dr. Jenks did mention the mobile medical unit that we're super excited about. That's going to help us to extend our bandwidth, and hopefully we can work to establish a consortium of mobile medical units to go to every facet of Durham County.
Very good. Thank you. Any other questions for Dr. Jenks? All right. Thank you very much, sir. We appreciate it. Great information.
My pleasure.
Okay, moving on. I think we're making decent time here. We have our public health vacancy report. Dr. Jenkins, we'll let you.
Thank you so much, and I'll be very brief, Mr. Chair and members of the board. We continue to make strong progress in our vacancies. Right now, we're sitting at 11.6, and as you probably can recall, over the past 6 months, it has been a steady drop and a steady decline. I certainly want to lift up the leadership team of the Department of Public Health. Every 2 weeks at our leadership team meeting, we review vacancies. We make sure that these vacancies are filled accordingly. And I know they get tired of hearing me talk about it, but I definitely want to give them praise for having all the interviews and making sure that we work with human resources to get folks onboarded and positions filled. That is all I have for right now, sir.
Awesome. Very good. If there are no other questions about the vacancy report, we'll move on with our public health NOV report. And we'll give Mr. Salter the floor to discuss that.
Yes, sir. Since our last meeting, I believe we've added 4 and removed 3. That's not a lot of activity for 2 months, but it's been kind of steady. You might notice one interesting thing: the latest addition is not for a illicit discharge of sewage. It's a property owner. If you noted, the property owner of a large tract of property subdivided the property and inadvertently cut the system out of the parcel that the house sits on. So now the home still has a septic system, but it's located on somebody else's property. And that happens from time to time. It's kind of interesting, but it happens from time to time. In this particular case, they're very lucky in that the parcel is large enough where the home is and there's suitable soil there, and we can get a new system permitted for them. So I just
Okay.
want that's kind of something that you don't see every day, but yeah.
Awesome. Awesome. All right. If there's nothing else that you'd like to highlight from the NLV report, I'll entertain any questions from the board or from the audience. Seeing no hands, we'll move on. Thank you, Mr. Salter. We appreciate the update. All right, the next item on the agenda is our health director's report. Dr. Jenkins will give you the floor once again to give us a summary of all the great information and programs that are being highlighted in the director's report.
Mr. Chair and members of the board, I wish I had enough time to do it, but as you can see, close to 30 pages of the health director report. And to be honest with you, it probably would be like 35, 40. There was some that was omitted. But again, we continue to lift up the great work of our dine team, our nutrition staff. They do a fantastic job. Can't talk enough about our dental practice under the expert leadership of Jim Harris. He does a fantastic job. We have, we do have the Tooth Fairy, which is a mobile dental unit that is up and running and really hitting those Durham Public School sites. So we're happy about that. We also want to lift up the expertise of Marcia Richardson, our IT director, and her staff for helping to get the technology where it needs to be. And then, of course, you heard all about the opioid settlement administrator and all the work that's going on with that. Want to give a shout out to Deputy Director Christian Patterson. Mr. Smith currently reports to Ms. Patterson, and along with Micah Gwendon and many others, they have been working really, really hard to get those funds in the right pots in order to make sure that we can get those monies out into the community. And then, of course, want to give a shout out to Kelly Warnock, who is one of our program managers in nutrition. She did a panel discussion really talking about the double bucks and her work with the farmers market, particularly the Black farmers market, and really food equity here in Durham. It's a lot of work that we're doing. It's award-winning work that we've been recognized for throughout the state, and she is certainly passionate about it. And I could talk on, but at this time I'll be quiet and ask the group if there's any questions you may have.
All right, I don't see any hands, Dr. Jenkins, so I think you have covered it quite well in your written report. So thank you, and congratulations to the entire health department for the great work that they're doing in our community. So moving on, we have no committee reports this evening. On our agenda item for old business, we have a review of the 2024 Board of Health policy and review of that policy review. Dr. Jenkins, you want to kind of guide us through that?
Again, the board should have received just information about the policy review. This is a requirement for our local public health accreditation, and it's certainly under the status of governance. So should you have reviewed it, for the most part, the only thing that's required, Mr. Chair McDougall, is just acknowledgement of that review and approval by this great board.
All right. So I think we have reviewed the policy, and I will entertain a motion to approve the policy.
Motion to approve.
Second.
All right. We have a motion to approve and a second. Is there any unreadiness or any debate? Seeing none, I will ask that Ms. Murphy take the vote at this time.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam, Dr. Miller,
Yes.
Dr. LaRon Jackson, Dr. Rosemary Jackson,
Yes.
Dr. Ordo,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio, and Mr. Glover.
All right. Thank you, Donna. All right. Moving on with our new business, we have two budget amendments totaling close to $115,000. So I will allow our director to give us a summation of those two amendments.
Thank you again, Mr. Chair. To be very brief, the board is requested to approve budget ordinance to recognize funds in the amount of $4,461 from the North Carolina Department of Health and Human Services Division of State of Child Fatality Prevention Branch for child fatality case reporting. We certainly want to give props to Dr. Cheryl Scott and Javetta Whitfield from DSS to do a marvelous job with our Child Fatality Task Force. These funds are to provide funding for local health departments to prepare and begin using the National Fatality Case Reviews reporting system. This is a change that was enacted by the North Carolina General Assembly, and it goes into effect next year. So these funds are to help us to be in compliance. The second is the board is requested to approve $110,737 of general fund appropriation to increase Durham County's contract with WellPath to provide comprehensive medical services for inmates in the Durham County Detention Center and residents of the Durham County Youth Home. This is a contract that Public Health has managed for quite some time. Per that contract, ladies and gentlemen, WellPath assumes financial responsibility for the first $400,000 related to the cost of off-site medical care. If those costs exceed $400,000, and Durham County will be then responsible for 100% of the cost of care not to exceed $150,000. Any amount for excess medical fees more than $25,000 is subject to a budget amendment approved by the Board of County Commissioners not to exceed an additional $125,000. It is important to notate that with this approval of this appropriation, that takes the total WellPath contract for fiscal year 24-25 to $5,297,463. And finally, for ratification purposes, the board is requested to approve and recognize $13,555 from the Division of Child and Family Wellbeing, North Carolina Department of Health and Human Services for Durham's Innovative Nutrition Education Program. Of the $1,368,946 total contract amount, $1,355,391 was previously approved by this great board during the fiscal year 25 budget cycle. These contract funds are used to develop and implement the DINE program, a school and community-based nutrition education program targeting SNAP-eligible Durham families. That is
very good.
All for your consideration, sir.
Thank you, sir. Thank you, sir. So I will entertain, if there are no questions, I will entertain a motion to approve the two budget amendments and the budget ratification just presented by Dr. Jenkins.
Motion to approve.
All right. Do we have a second?
Second.
All right. It's been moved by Dr. Ray and seconded by Dr. Orto. If there's no debate, we're ready for the vote. Ms. Murphy.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam, Dr. Miller,
Yes.
Dr. LaRon Jackson, Dr. Rosemary Jackson,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Gregorio, and Mr. Glover.
All right. Thank you. So the next thing we have is we want input from the board for agenda items for our next meeting, which is in February. We do have the opioid update that's already set to appear on the agenda. Is there anything else that we would like to have presented to this fine board for the February meeting? All right. Well, we'll leave it up to Dr. Jenkins and his staff to complete the rest of the agenda for us for that February meeting. All right. Do we have any informal discussion to be had?
Yes.
I was
Very good.
about to say, I knew she was going to say something. Mr.
I may
Chairman.
not entertain Dr. Jackson. No, we'll give you the floor, Dr. Jackson. You go right ahead.
I just want to say that it has been an honor and a pleasure to serve on this board with all of you, the folk before and the ones that will come. It was truly a pleasure and an honor to serve this great county and our great health director. And the staff is just off the chain. So we can't say enough about the staff at the health department. They are just top notch. So continue the good work. You won't be seeing me. You might see me around, but I won't be on the screen anymore. This is my last meeting. And they already asked me, the county reached out and said, do you want to apply again? I said, thank you, but I'm good.
I was going to say, I think you
Thanks
can
for
still,
everything,
you can still serve
Rosemary.
if you'd like, but we certainly appreciate the many years that you have served on the board and can appreciate also your desire to move on to a different role and responsibility. So thank you so much for your many years of service.
Yes, it was truly a pleasure.
And
Y'all keep up the good work.
and for guiding me to succeed you as chair. You were a great role model and a great resource, truly, as I transitioned into the chair position. So thank you so much personally.
Well, you certainly are doing an absolutely wonderful job.
Thank you. Thank you.
No one would have ever known you were a new chair. So keep up the good work, all of you.
Awesome.
Chair, in your
Congratulations.
absence, we certainly want to thank Chair Alam. This will probably be her last meeting. We were informed that we will have a new commissioner rep. So we look forward to welcoming Commissioner Valentine on the board.
Okay.
So we'll certainly conduct ourselves accordingly to make sure that the new member is warmly welcomed and properly acclimated.
Absolutely.
Right.
Absolutely.
Okay, good.
Awesome. Awesome. Well, we did pretty well, just over an hour. So I will entertain a motion to adjourn if there's no other business to discuss.
So moved.
Second.
All right. It has been moved and properly seconded. I'm sure there's no unreadiness, so we're ready for the vote.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam, Dr. Miller,
Yes.
Dr. LaRon Jackson, Dr. Rosemary Jackson,
Yes.
Dr. Ordo,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio, and Mr. Glover.
All right. I think we are good. So thank you again. Merry Christmas. Happy holidays to everyone. And we'll see you in February.
Yeah.
Happy
See you
holidays,
next year.
everyone.
Except for Dr. Jackson.
Yeah.
I'll see you around.
Hi,
Yeah.
Dr. Jackson.
Take
Maybe
care.
maybe I'll be the person that comes to the meeting.
Yeah, come and hang out with us. All right.
All right.
Take care,
Bye,
everyone.
everybody.
Bye.
Donna, do I need to come and sign off on any documents? I think I took care of it.
I think you're okay with the last minutes.
With the
I have
October meeting.
October, you had already signed those.
Okay,
So
yep. So
I think you're good.